Hello, everyone. This is Dr. Tamisha Denis. I am much more casual today. As you all know, that fitting live streams into my life can get very busy. So I just hurried up and got this together. I'm sitting on the floor of my YouTube studio because I have a lot of dental models to go through today. I literally went to the office before I got here and I picked up all the dental models that I had in the office, like literally all the dental models that I have in the office, and I'm gonna like play with some of them. Hi Harmony, hi Rock Simmer, how are you guys today? So I'm coming on a little earlier than normal, and just full disclosure, my children are gonna come home from school really soon, and I just wanted to make sure I squeezed this in and got it in. So I got so many really great questions this week. I'm just like kind of like, wow, these are really great questions. So I think that I'm finally getting the hang of this whole YouTube live thing, and I'm just trying to make sure that I can look at the questions on my phone and answer them. So if you know how I do lives, if this is your first time on lives, can you say my name? Harmony Duncan? Shout out to you. If you can say your names, introduce yourself. If you want to ask questions, just go. My personality is that I go a million miles a minute. That's how I am. So I will look here. I will answer questions. I'll go to the YouTube. We'll play with this. Awesome. Like I said, I had a person that answered me a very kind of detailed, intricate question about, hi, Rahab. So I had a question asked about dentures, and I promised that I would start off this conversation, talking about dentures, because I really wanted to make sure. I didn't feel like I could answer all of the questions just via, if you see any of my YouTube comments, I type a lot. So that kind of goes with my personality. I'm very verbose, so I talk a lot. My favorite color, as of currently, my favorite color is gold. I'm just feeling gold right now. I don't wear gold that much. If you saw my Christmas party stuff, I wore gold. I want to shout out to Rahab because he's, I never figured out he or she. I'm so sorry. Tell me right now, please, so I don't mess it up. If was the one that recommended, oh, your favorite color is gold too? That recommended that I do a video about ASMR. I'm a sheep. I knew that. I'm sorry. You can't really know. Anyways, but I'm glad I know. So she's the one who recommended that I do a video about ASMR. And if you guys don't know what that is, that's basically oddly satisfying, which means that you like something that has weird. It's funny because I have one of these. I didn't mean to bring it, but this is a sterilization pouch in dentistry. You use it to put instruments in. And actually one of the sounds that I was considering was the opening and closing. I bet you I just lost a couple subscribers by doing that. So my son, Aman, is watching you right now. Hi, Aman. Am I going to post this on YouTube? Post this on YouTube? Am I going to post the ripping of this? Let me know if that's what you mean. Okay, so I want to finish answering that question. Believe me, I'm still watching everything that you guys asked, but I wanted to answer this question. And that person, if whoever is the person who asked about dentures is on here, I definitely want you to kind of talk. And if you watch these lives, I kind of sometimes allude to something that I'm possibly going to talk about in the future. But oh God, look at this thing. Okay, I have this. This is not quite answering the dental question, but this is actually a jaw. Am I going to post this? Oh yeah, of course it's going to be live on the video. You can always watch it later. And if you miss anything and you have to leave, you can always go back and replay it. So this model is a model of someone, or not really a real person. I'm sorry, the lighting is not so great. I'm trying to find the best angle of someone. When you lose teeth, how over time, the loss of your teeth, the jaw shrinks. And if you know anybody, we always like to use the analogy of, hi, oh, are you leaving? And that's why, goodbye. See you later. Love you too. So we like to talk about how when you have teeth and you lose the teeth, you lose bone. So if you're in a single state situation where you have a single implant, like I have right here, losing the bone is a little bit minimalistic. But when you have a whole jaw, when you've lost all of your teeth, you start to have that whole witch look. I know people say, that like an old witch, and that's because you're also losing bone as you are as the teeth are gone. If you have a tooth, your body says, hey, I have a tooth, let me keep bone. If you don't have a tooth, you don't have bone. So sorry, if you see my ripped jeans, I'm super casual today. So I'm just gonna go through these models here and whatever models I have. Sorry, nails are not done today. That's what an implant bridge looks like. And when I was picking this up from the office, I realized that the teeth had fallen off and the teeth are sitting here. So this is what an implant bridge looks like, if anybody has curiosity. And this is what, maybe if I fix the angle of my lighting. This is what an implant looks like. Implant bridge. See, like 2 posts, and then the 3 teeth go over it. This is what a partial looks like. It's interesting because I use these a lot. Okay, so I can't get it off. I'm gonna fix this lighting situation here. Sorry, close up. Let's see if that makes a difference. So this is what a partial, Valplast partial. I have a really popular video about whether you should get metal-based partial or Valplast partial, and this is what this looks like. But to go on to the denture question, it's really a thing of you're gonna lose bone, and when you lose bone, that's why the denture usually fits a lot in the beginning and doesn't fit so well in the end. So when you're, I know the person that asked me the question said that they're only 27 years old, and I understand that that can be hard. I don't think that the process of making a denture is so difficult, but what's the process of the denture is the lifestyle. So you're gonna modify how you eat now. You're gonna modify how you speak. You're gonna modify pretty much all of the behaviors that you normally do with no problem. You're gonna have to think about it. The person was also saying that when they were afraid that, hi Christina, I wore a flip, lost front infant. Oh, you wore a flipper? You wore a flip, you lost your, did you get it replaced? So you get it replaced? I'm curious. So it's a lot of lifestyle changes. It really changes a person when they have to wear a denture. Obviously, implants are the most stable option, but if you don't, that's what it is. And you kind of have to make peace with it. Dentures actually don't look bad. They don't look bad. Here's another example of a denture. This is a full lower denture, but this is also implant retained. And I think on my last live video, I can remember Mega Hips. I'm pretty good with names most of the time. Asked me about this, but this is what the implants look like. This is a mini dental implant, and they kind of snap into place like this, like that. I think I have a flipper in here too. Oh, this is one of my favorites. This is called an all-on-6, and this is literally 6 implants placed in a way so that we can put a full implant bridge. Because I was so fast, sorry, I keep looking out the window. Because I was so fast in getting out the office, I know that the second part of this isn't somewhere, but I do this procedure a lot. This is very expensive to do. And if anybody wants to hear numbers, this could be anywhere between $25,000 and $30,000. No, I don't do these all the time, but there are special cases where somebody who needs very, very expensive because they're losing all of their teeth. Now that's another option when it comes to if you've lost all your teeth. What do you replace it with? Not anymore. I got my teeth fixed and got implants, braces, and now I have a crown right there and I can't tell. I lost it. My sister, no. Oh my gosh, with a plunger. I've heard stories of people. One day I'm going to do a video about all of the stories that I have heard. I've heard people getting hit by baseball bats in their mouths. I had a patient. Oh, I remember this story. I had a patient. It was summertime. I think it was Memorial Day weekend, and they jumped into the pool. And when they jumped into the pool, they slid across the bottom of the pool and basically shaved off the front of their tooth. It was pretty bad. They came in on Monday morning. I always have these interesting things. Hi, Too Tall 71. Hi, I have a question. I'm thinking about getting braces only on the top. Only on the bottom because my teeth are straight on top, but I was told I would have to get both top and bottom. Is it true? And the answer is yes. Everybody, when they, I'm trying to see if I have a model that can represent the reason that is true. When you have braces, okay, all right, this is not the best model because it's missing some teeth, right? But when you move your bottom teeth, we are talking, I'm going to say a fancy word. The word is occlusion. Occlusion means how your teeth come together. And the way your teeth come together is really braces affect that. So let's say, for example, in your case, you want to move only your bottom teeth, right? You don't want to move your top teeth because they're straight. But as you move these crowded teeth, it is going to affect how these top teeth sit within these teeth. So how can you just move these within here? It will affect your bite. So let's say, for example, all of these are crowded everywhere and you want to push them back. If you push them back without pushing these back, it's going to bump up against the top teeth and it won't be able to change. There are very certain situations where you can do braces only on top or only on bottom. And I know the orthodontist can navigate that. But the reality is it's because of your bite. If it weren't for your bite, it wouldn't matter. Basically, the braces on the top are doing nothing. They're not changing anything, or they're changing very minorly to accommodate the movements that are happening on the bottom. I have patients ask me that all the time. It's like, oh, can I just get the bottom? My top is fine. Or can I get the top? My bottom is fine. It's just your bite. Sometimes I try to see if I can do it, but sometimes, listen, it's not worth the sacrifice not to do it. Rahab says, Tamisha, do you ever do one single front veneer? I don't like it. Oh, let me know if your son has an answer. I don't like it. I don't like to do a single anything, a front tooth, like a single crown or a single veneer, simply because it is so difficult. It is so difficult simply because you're trying to match. Now, if you're trying to match a natural tooth, good luck. The texture and everything of a crown versus a natural tooth is totally different. If you're trying to match a crown, even better luck. And most people don't have a consistent color from top to bottom on their tooth. I just talked to somebody yesterday about the same thing. And it was like, I always advise, I was doing one implant on one front tooth and then the other tooth was fine. So I said, look, we're going to do the implant now. If you want to take a chance and we just do a regular crown on that one, and then if you feel like it matches, good luck. I have actually done it successfully, but I don't know if it's going to happen. So I think it's always better if you can afford to do both, you can afford to do. Now, if you want to take the chance and you say later on, I'll make that decision, that's fine too. But it is better when the lab makes them the same, even though there's different colors and shades. It's better to make them at the same time, just in case there's a little variation. This is your front tooth we're talking about. Hollywood Star 2000 said, if you're missing your two front teeth, what are the best options? It depends. And I love these questions. These questions are freaking awesome. It depends. And if you're just kind of coming on, the reason I keep looking down is because I have literally a basket full of dental models. It depends. It depends on, honestly, the financial situation. My best, if you have good bone, I'm going to advise implants. Who wants to walk around taking their teeth on and off? If you don't have to take your teeth on and off, oh, look, it's a flipper. Okay, who asked? Christina, about probably wore one of these guys, a flipper, and it just goes. So if you don't have money, you get one of these guys. I replaced a patient's tooth that literally had one for 25 years. He had it for 25 years, his front tooth, and I replaced with implant. Toss this in the garbage. So if you can do, if the cheapest option is to get a flipper, meaning you get two teeth. The second option is a fixed option, meaning that this is a removable option. A fixed option means something we put in your mouth and don't take out. Depending on the state of your two side teeth, like we call them your laterals. We call them your laterals. So two front teeth. This is a lateral. The other front tooth is missing on this one, but this is a lateral. If those, you can do a bridge. It's not a bad idea. It's not the best option, but it's not a bad idea if financially it makes the most sense. Like those two teeth are in good shape to be holding up a bridge. If not, then the best option is to do two implants on your front teeth, right? So removable option, flip-a-do, or permanent flipper, like something like this, right? Or fixed option, bridge, more permanent option, two front teeth. Too Tall says, thank you. I'm glad. I hope that made sense. I know sometimes it's like, dentists, they get such a bad reputation. Like I see it too. Like people come from other offices and they say stuff that other dentists say. And I cringe a little. I'm like, that's not true. This is one of the models that I keep in here. You're welcome, Too Tall. You're welcome, Rahab. So this is a model I did a video on that I've had for a long time. Hakan. Hi, Hakan. How are you? And this model is basically the steps of a root canal. These red things actually represent abscess, and you can see somebody, well, if you look from the top, you get a cavity. Cavity goes into the nerve, causes an abscess, implant, I keep saying implant. Oh, this says my connection is unstable. I've been having problems with my internet. So we clean out the inside of the tooth. I don't know if I'm still recording. I hope so. And then we fill the inside of the tooth, and then we put a crown on it. Crown. All right, somebody let me know if you still can hear me and everything's still good. Okay, because I'm getting some weird messages here. Which endo system do you use? Wave 1 Gold? No, I use ProTaper. I still use ProTaper. ProTaper is like what? The oldest Dentsply, and this is for the technologically dentist people. Dentsply has a lot of different, we can hear you, great, thank you for saying that. Dentsply has a lot of different systems. I think a lot of them are the same, but I personally prefer ProTaper, but I like all of them. You like the root canal model? I personally prefer ProTaper just because that's the way I was taught. I traveled to Scottsdale, Arizona a very long time ago, and I did their classes. They did not teach us that in dental school, so I had to learn. Wave 1 Gold is good. I mean, all of them are great. I mean, they're kind of like the go-to people for endo. I know, I forgot the other company's name. It's not coming to me right now. It has a really good system too. But if you're doing rotary endo, I mean, Dentsply is where it's at. Christina Love, I have a low S. Blah, 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 blah. Oh, yes. Okay. I didn't read all of it. I mean, I did read all of it, but I'm not going to read it out loud. So self-esteem and your teeth. I saw someone very recently, and basically, and I think I've said this before, and I'm going to say it again. A lot of people, what happens to them is they start to modify their lives according to their teeth, which to me is quite ridiculous. I know that that's ridiculous. I say that because I say there's answers for you out there. It's kind of like, you know what, you can fix something. And when you see people who are not fixing it, it makes me a little sad. And I hate seeing people who laugh like this and they hide their mouth. You know, it's really important for you to feel confident in your smile. Now, if it's not affordable to you, and most people's barrier is money, start with what you can. But a lot of times when, like I saw a patient yesterday and she had a broken front tooth and she didn't like it. Now, there was other things going on in the back of her mouth, and I definitely could have addressed those first. But it's really important for us to start with what is most important to you. It doesn't make any sense for you to spend thousands upon thousands of dollars at the dentist, and then when you look in the mirror, you still don't like what you see. Do you understand? Like, that to me is illogical. So my advice to you is that make sure that you go and you at least try not to be. Now, if you have a limitless budget, this is not for you. This advice is not for you. Then if you have a limited budget and it's just a fear of the dentist that's keeping you, that's a totally different story. But if you have if you have limited budget, you go and fix the one thing, have realistic expectations and fix the one thing that really bothers you. Get to that, start working on that. Stop letting time pass by. Start to see at least get a consultation and say, you know what, because a lot of times people have an idea in their mind of what it would take to fix, but what about what it would take to just improve it just a bit? You know what I mean? How do I feel about complaints okay. Oh my goodness. Okay, litigation. And that is always a big thing in dentistry. Without getting too specific, I will say once a dentist in the United States, I'm in a high litigation area. I live in South Florida. You know, different parts of the country have we have to carry malpractice insurance and all that stuff. But what happens is once I touch your tooth as a dentist, it's like I own it, you know, which is a very strange concept to me still, that people believe that once I have done something to your tooth, I own it. You can go and chew rocks at home and somehow it's still my responsibility if it breaks. Now, there is two extreme versions of that because I tell my patients all the time, I don't do warranties. I don't have a written warranty, but I fix it if it's wrong. Like if I feel like there's something that I can do for you, I'm going to be trying to help you, especially if you come to me with reasonable you know, thing like, oh, like if you are screaming, yell at me, I don't really do well with that. You know, I'm still very receptive. But at the same time, the reality is I cannot control everything that happens in everyday life. I don't control if you're a grinder. I don't control if you get in an accident. I don't control the way you eat, the way you maintain your teeth. So even if I've done something for you, I can't say 5 years from now, if it breaks, it's mine. But then there's still a balance, because I see things from other dentists that I say, you shouldn't have done that way, and maybe this wouldn't have happened. So I'm not going to give like a blanket and say, well, if something happens, it's not my fault, or if something happens, it is my fault. That's really difficult for me to say, but I will say that I do feel a responsibility to my patients, and I don't, once you're my patient, I kind of consider you under my care, and I want what's best for you, and I want what I do to work. So I'm going to be realistic with my expectations as to what you're going to get, and if there's something I can prevent bad, or I think it may happen in the future, I'm going to let you know that too. So I hope that helped without being wordy. This is, and I apologize because I threw these in. So some of the pieces, this is a model that I used a long time ago in one of my first YouTube videos. I hope that answered the question. In my YouTube videos about implant versus bridge, and then you can see, and I can't remember who asked this question, what's the best options for replacing two front teeth. To a certain extent, this is going to give you a demo of what a bridge is. So a bridge means crowns that are stuck together. That is a simple explanation of what a bridge is. You can kind of see it behind me, but crowns that are stuck together, 3 crowns stuck together, that's a bridge. It could be 4, it could be 5, it could be 10. The longer span, the more chance. So when you have a bridge, imagine this is not here. When you have a bridge, what you're doing is basically you're going to use the other 2 teeth to hold up and make it appear as if there's a tooth in the middle. This is not exact replica. This is not the way that we do it, but it is an example of what it would look like. So if you have an implant, you don't have to touch the other 2 teeth. You just put the implant in the middle. By the way, Hakan, are you the person who asked me about in the comment? Yes. Traditional wearing full dentures, is that possible to eat with them? Of course you can eat with them. You can eat with your dentures. You're going to modify how you eat, and your chewing power is not going to be the same. I find that people complain about the simplest things with dentures, and it's, when I say complain, I'm using that lightly. What I mean is, like, for example, people will say things like, oh, I can't bite my salad because the grinding power. By the way, if you're a dental geek, you'll know these are 2 lowers, so don't use this. The grinding power of a denture is not the same as your teeth, the tearing power. So you're going to see the things, like I had a patient who's like, I can't eat a bagel. You know, it's like the weirdest things that you don't really anticipate will be a problem, and sometimes a problem with the denture. But yes, you can eat. Some people live very happy lives in dentures. I'm not going to trash them at all. They've worked for very many centuries effectively for a lot of people. So you can eat that. How can you prevent bone loss? It's very difficult. I don't know if you're at the beginning, but I was going through this model, and this model basically is showing how your jaw shrinks over time when you lose your teeth, and kind of scattered in different ways, because I was about to do a video with it, is I have a whole bunch of these models. So this is not exactly it, but what you don't want to end up is like this. And like this, that basically means there's no more gum. They have that kind of sunken look. There's no more bone. I'm sorry. I actually done implants on a person that looked like this. So basically, you're not placing it in the alveolar bone, which means the bone that goes up and down between the teeth. You're placing it in the jawbone, in the jawbone. Here's an example. I hope that helped. Here's an example of a partial, a metal frame partial. And I talk about these a lot because if something happens with them, you can have the lab add another tooth. So let's say, for example, like this one. Oh, this lighting is killing me. You lose another front tooth, you can possibly add another one. So it gives you a little bit more flexibility. Here's another example of partial, because you have to remember, it's just replacing what is missing. So where you see the teeth, that person doesn't have those teeth. Where you see the teeth need to be, then that's where it is here. Another, well, this is actually a flipper. This is a flipper for back teeth. I don't typically make flippers for back teeth. I usually make them in terms of front teeth, because if I'm doing an implant on you and we're making a flipper, there's really no need to do that. Here's another flipper. Oh, I found my implant bridge. I knew it was in there somewhere. So implant bridge, 3 3 teeth. Oh, please be good lighting. Oh, okay, so I give it a little better. So implant bridge, and there in the implant bridge is one of my favorite things to do. Because if you have a partial, so can you imagine if you were wearing one of these guys and you have 3? Oh, someone asked this question earlier. They were talking about Hi, Hollywood Star. Do I do digital dentures? No, I don't. First of all, I don't do a lot of dentures because I do so many implants. But I don't do digital dentures because I've gone back and forth with opinions on that, and I cannot get a consensus. Meaning, like I've heard opinions like, "Oh, they're awesome and they fit great." It's a whole system. The name of the company, I think, is Digital Dentist. No, they have another name that does digital. They're like, it starts with an A. I just can't think of it right now. It starts with an A. If anybody knows what it is, they can tell me. It starts with an A, and in those, they basically scan the model, scan the mouth. They send you a try-in, and then when you have the try-in, then as long as you verify, then they mill it. So it's all 3D milling, and we do 3D milling in our office too. Here's another denture example with implants, and you can see the implants underneath. I know this is great lighting, not great lighting. And then just like the other ones, they have these little holes there. They snap in place. Yeah, so I can't figure out if digital dentures, my kids are about to come home. So if you see them interrupt us for a second, then they will, and I may not be able to stay much longer. This is a night guard. This is a night guard, very important night guard. This is what it looks like. I have one of these babies. I usually recommend night guards for the bottom. This is a night guard for the top. And the reason I do is because I think it's a lot more comfortable to have a night guard. So that's what night guard looks like. Sorry, my daughter. Oh, I have some Invisalign models here too. Hakan says, oh, you are the one who asked this question. Yes, it is okay, so with the upper denture, you should be able to wear it without glue. Most people wear their dentures without glue on the top with no problem, because even if you lose a lot of bone, and I'm trying to find my upper denture model in here, even if you lose a lot of bone, you still have your palate, and your palate is really where the suction comes from. So once you have your palate, it kind of creates this, and then the flange, we call it the flange, the area up here that sits up in here, that area, that is what is going to give you, okay, here it is. All right, so here's the denture. There's a lot of different parts of a denture, but one of the most important parts is the palate. And also we call it this posterior palatal seal. It's the junction between your soft palate and your hard palate. So the hard part of your mouth and there's a little like soft part that we make an impression there, and then it helps to seal. And so what we want is when you swallow like that you create a suction, and this area kind of sits in here, and then it creates a suction. Most people can wear their upper denture with no glue at all, but most people have harder time in the bottom. So if you notice, a lot of my lower denture models, those are the ones that have the implants. So I've been told implants were basically invented for the lower denture, because dentists hate doing a lower denture because it's so hard. You have your tongue who wants to constantly flip your denture out. So usually those require adhesive. Now, if you are having your teeth freshly taken out, that is called an immediate denture. That means we already made the denture, we take the teeth out, and then we put the denture in right away. That's called immediate. That means you're not waiting with no teeth then to take the molds and the whole process. Now, those people who have usually immediate denture, they have better bone because they just lost their teeth, right? But over time, you will continue to lose teeth, and that is the hard part, right? So eventually, even if you can live happily with an upper denture, you won't long term. Now, I see people in all kinds of things who don't use an adhesive and they manage just fine. But because you're younger and you're losing some teeth now, if you have good bone, that's what's going to make the difference of whether or not you need to use adhesive or not. Something I didn't mention about what's another modification of having an upper denture is that, oh, you're welcome, Fatima. Hi, Fatima. Is the palate. Not only does a palate add suction, but some people who gag, they complain about the palate making them feel like they're going to choke. I usually try to make them get used to it first, because the more of the palate you take away, the less suction you're going to have. Remember that posterior palatal seal I was talking about before? And then also, the reason that people hate the palate, not just because of gagging, is also because it changes the way you taste food. You don't really know how much food changes until somebody blocks the roof of your mouth. The sensations of your tongue touching the roof of your mouth, naturally, the taste buds and everything like that changes when you have the roof of your mouth covered. That is another reason that people like to get dentures on the top, because essentially I can cut off this whole part and leave the dentures there, and then you still have a denture that's removable like this guy, but then your palate doesn't need to be covered. So that makes a huge difference too. So yeah, there's a lot of lifestyle changes that have to happen. Another night guard, a lot of lifestyle changes that have to happen because you no longer, sorry, I'm making a lot of noise. Oh, here's something fun. I give these to the kids in the office. You're welcome, Hakan. You let me know if you have any other questions. I would let it bounce around where you wouldn't be able to see it. Okay, he's gonna jump around there. Oh, this is a retainer. This is actually a retainer. So retainer, very, very important. And you can see this is actually this is MTM. I tell people all the time, it's not only Smile Direct and Invisalign. MTM, Minimum Tooth Movements, is another company that makes it. I don't know how these guys got in here, but these guys, just because they're in here, I might as well show you. This is an intraoral mirror. This, we call it cotton pliers. Pick up things with it. And this is called an Explorer. So when you go to the dentist and they're poking you in your teeth, this is what that is. All right. I am going to here's another molar. These little loose things I have in here. I have another model, and it's basically showing how when you get a cavity, how the cavity goes from the enamel to the dentin. I had a patient the other day say, why does my tooth look yellow? It's because you ground away all your enamel, and now you're looking at the dentin, which has a yellow hue, and then the pulp, that's the nerve. So if you have a cavity and it starts to travel in, you're going to be in pain. You're going to be in pain. Another situation where you can see the top of the implant. I believe these are Straumann type implants. I place Hyacin type implants. And oh, this is a cast post. It's a very strange thing. It's not something we do very often. There's silver things that stick out of your tooth. Most people, if they have that, it's because they've lost a lot of tooth structure. Oh, and here's a last thing. This is really cool. I don't make these very often because I'm not a huge fan. Sorry, I keep looking. This is called a Snap-on Smile. Snap-on Smile. They try to sell fake versions of this online, and they're not very good, but they cover your entire teeth. So if you're missing all these teeth, it goes over the top of that. Not really a huge fan of these because you can't eat with them. Remember how I was showing you this other model? This is what happens when you don't get your fillings done. This is what happens when you don't get your fillings, and it goes into the nerve and you end up needing a root canal. It's not very nice, and this is very, very painful. I think that is all my models. I have much more. I know I have more. You should see the mess that I have in front of me. This is another version of this. So basically, you go from this cavity, right? Something like this to something like this. Nobody wants that. That's just pain, 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 pain. All right, I think I went pretty much through everything. This is the healthy version of this. And I have these usually very organized, but because I grabbed everything so quickly. All right, so if no one has any questions, if nobody has any questions, I'm going to start wrapping this up. I always enjoy these sessions. I actually had fun doing this. By the way, I had a lot of fun doing that. If anybody watched my ASMR video, I had a lot of fun doing that. I don't know. I didn't even realize how making noises was fun and how people might enjoy the sound of. I personally go to bed every night listening to something called Good Vibes, which is all of these kind of like blanket noises, because I don't like the sound of silence when I'm going to bed at night. So I like to listen to sounds like that before I go to bed. And so when I got that request, I was like, that's perfect, because that's something up my alley. That's something up my alley. So You're welcome, Hakan. I hope that please let us know in the comments how your denture journey goes. And it's thank you, Christina. How your journey goes, and if you have any particular questions, obviously you don't know the questions you have until you go through something like this. And yes, you do your research and you try to be prepared. But one of the wonderful things is once you start to do research, you know, my goal always, I say this all the time, my goal really is to make people feel not alone, that a lot of people go through this stuff. Listen, when you see somebody smile like this, you don't know what's in the back. So everybody assumes, oh, you're so much better, you never have any problems. And the reality is a lot of people have a lot of issues that they're always dealing with. And it's hard for them because they feel like everybody's doing so much better. You know, people come to me and they're like, they think that they're the worst mouth I've ever seen. Ooh, I've seen some mouths. I've seen some mouths. If anybody's seen the videos that my sister and I did over Christmas, the week of Christmas is, you know, we were talking about, and she's seen some mouths because she's worked on people who are homeless and people who have no access to care. No access to care. That means they can't get to the dentist at all. And, you know, there's a lot of people suffering. There's a lot of people who have problems they're ignoring. A lot of people in fear. And even though I'm here to inform, I'm really here to make you feel better through information. So if I can make anybody feel a little better, just a little bit, make them just a little not so scared, that helps me, because everybody can't come to my office and see me, even though I welcome anybody who lives in the area to come and see me. But it's difficult, you know, and it's expensive. And, you know, I never shy away from that fact that I know it's expensive. But at the same time, I try to say, let's stay realistic. Let's come up with goals that make sense. Let's be partners. Let's figure it out together. This is my last model. I like this one. This one just shows all the different, oh, this is periodontal disease. That's plaque, by the way. How when you have healthy gums, it's nice and pink. You know, some African Americans like us, we have other gum colors that doesn't make it unhealthy, and how the plaque will cause recession and everything like that. Okay, I'm going to take the last question. Is prescription fluoride toothpaste bad to use over time? My teeth were very cavity prone, and I was wondering if using it for a long period of time would cause any side effects. The short answer is no, there's no negative side effects, but you do want to watch for staining. There are some kinds of fluorides that, I want to say stannous fluoride, but I will say that very slowly. There's some kind of fluorides that will cause staining. There's some people that do not get staining at all with that, but you watch yourself. Now, everything needs to work. I know, you know, people say, oh, I don't want to use fluoride toothpaste because I don't believe in fluoride. Okay, that's fine. But if you start to get cavities like crazy, then maybe you need to use this fluoride toothpaste. Now, if you're using fluoride-free toothpaste and you're just doing fine, great, do that. But if you're using a fluoride toothpaste and you're still getting cavities left and right, we may consider if it's even making a difference for you. And I don't know, are you using it exclusively or are you using it? So the main side effect that I've heard of, and I can do a little more research on that, is the whole, you may get some staining. But if you're not getting staining, you're getting good dental visits, your dentist is saying good things, stick with it. That's just fine. Do you know what I mean? I believe in results. I'm not somebody who blankets anything. The way that I treat one person is different than the way that I treat somebody else. So it's really important to me that when I say something works, it should work, right? I believe that with medication, and that's why I like dentistry as opposed to medicine. The results are very practical compared to, it's like, okay, it's broken, I'm going to fix it, as opposed to, let me give you a pill and see what happens. Oh, I didn't even realize my last was falling. Christina says, I have a question. I use activated charcoal. Is that good for me or bad? No, I use activated charcoal all the time. I use it in toothpaste form. I use the powder. It does have a slightly abrasive thing to it. I find that the really fine powders are as abrasive as a regular toothpaste. I don't believe in those toothpastes that have those little granules in them. They're like scratching your enamel. And the charcoal toothpaste tend to be a lot finer powder. I don't believe that they have harm. I use it myself with no problem. However, again, just like answered the last questions, make sure you pay attention to yourself. If you start to develop sensitivity, I have never developed sensitivity, pay attention to that. But if you're not developing sensitivity, you're fine. I had a patient, we started selling charcoal in the office, and he was using it every day, and then he said his gums start hurting. Well, maybe you shouldn't be using it every day. I was using it every day for a long time because I was like in love with the stuff. I was in love with it. I love it still. I just forget sometimes. But no, it won't damage you, but just pay attention. If you feel like you're getting the desired side effect, remember charcoal is good to ingest. It's a detoxifier too. It attaches itself to free radicals, which are cancer-causing things. And so, you know, if you're getting good results, keep using it, but alternate sometimes, you know. So if you feel like, man, it's scratching a little too much, then maybe you just use it twice a week instead of every day. But me right now, I probably use my charcoal powder. I use charcoal toothpaste sometimes. I'm still finishing up my Moon toothpaste. If you watch that video, man, that stuff tastes really good. And I use Colgate. I'm not a huge fan of Crest. Shh, don't tell them. But no, I don't think you're going to have any long-term bad side effects. Any other last questions? I always talk longer on these things than I'm expecting. I hope, you know, I get a lot of feedback because of the way that I look and the fact that I don't look like a dentist. I don't know if my ripped jeans made any difference to anybody, but listen, information is information. I don't discriminate, so I hope other people don't either. I hope you enjoyed this video. And if you have any questions, make sure you comment below because I read 95% of them. I say I don't, it's not that I don't read all of them, it's that sometimes I'm not sure if I'm getting all of that. I use my little tube buddy to see if I can answer them, and boy, like I'm just trying to always like see, okay, did I answer that? And I really want to help. I really do. So if anybody doesn't have any final questions, I have to go, but I appreciate you guys so much. I appreciate all of the questions. I appreciate all the comments. I appreciate all the likes. I appreciate all of that. All right. I hope you guys have a wonderful day. Hakan, Hollywood, Fatima, Christina, Rahab, and any other names that I didn't say. Thank you very much. Rock Simmer, Too Tall. Who didn't I say? And everybody else. Have a wonderful day. If you ever want a shout out, I give it to you. Bye. Hold on, did I miss anything? Bye.